It's a scandal. Federal and state governments have been making the COVID-19 crisis even worse. Hello, I'm Steve Forbes, and this is What's Ahead, where you get the insights you need to better navigate these turbulent times. Before taking office as president, Joe Biden promised 100 million vaccinations in his first 100 days in the White House. He can actually fulfill that promise, but he will have to make big changes in government vaccine policies. We all know that most state governments have botched the distribution of COVID-19 vaccines with unnecessarily complicated bureaucratic formulas. Federal guidelines are hindrances and not a help. Instead, states should have adopted a simple formula that made vaccines available to true frontline caregivers and to those people most vulnerable to succumbing to this dread disease. They could have started by vaccinating those 85 and older, then to 75 and above, and then 65. 80% of pandemic deaths are in those age ranges. After that, shots would go to people with underlying conditions. Unfortunately, most states imposed cumbersome, confusing rules that ended up with unused vaccines. This has resulted in avoidable deaths. Regarding that deadly blunder, governments then lurched in the opposite direction, declaring that anyone over 65 was eligible. The result of that hasty move is a shortage, made worse by inadequate distribution points. Concerning distribution, states should follow the example of West Virginia, which, among several common sense decisions, immediately mobilized independent pharmacies to administer vaccines. No wasted dosages there. Here the scandal gets worse. There is no real shortage. AstraZeneca has millions of doses ready to go, but the FDA is holding up distribution because it is forcing the company to go through more testing, even though the vaccine is being safely given in Britain and a number of other countries. In addition, the AstraZeneca Oxford version does not have the cold storage challenges of the vaccines from Pfizer and Moderna. You would think in this emergency, the FDA would shed its rigid bureaucratic ways to help save lives. Think again. Moreover, FDA foot-dragging delayed the introduction by weeks of those first two vaccines. This pandemic has been made worse by certain states, especially California, imposing, yet again, draconian lockdowns by refusing to recognize that keeping people cooped up makes the spread even worse. No wonder trust in public health officials is so low, not to mention in mandate-happy politicians who then flout their rules. Hopefully, President Biden will change that. I'm Steve Forbes. Thank you for listening. Do send in your comments and suggestions. I look forward to being with you soon again.